Hello, I will talk in details about the correct treatment of epilepsy. How do we make the correct diagnosis? How do we make the testing? How do we do the correct treatment and explain the triangular method in details for the best results about to treat your epilepsy and get an excellent control of that. I'm Dr. Omar Danoun, an epilepsy specialized neurologist, and I'm here today to give you all this information and answer all your questions in details. So welcome everyone. So first of all, let me tell you about the triangular method for epilepsy. So triangular method of epilepsy is a unique way to understand the epilepsy and seizures, how to make the correct diagnosis, how to do the correct testing, and then the correct treatment and duration. Before that, let's tell me, where are you joining us from? So welcome, where are you joining us from? Hello, Aditya, welcome everyone. Welcome, Hassan. So please tell me, where are you joining us from? From India. Welcome from India. So just tell me, where are you joining us from? Which country? From India, excellent. From Egypt, welcome, Ahmed. From Wayne, Indiana, excellent. Fort Wayne, from Ghana, from UK, nice, everyone. From Ethiopia, Africa, excellent. Thank you so much. From Jordan, welcome. From England, welcome, everyone. So thank you so much for joining us all over the world. I'm very proud of having such a very diverse audience from US, from Chennai, India, from Florida, from Ireland, Wisconsin, everyone. So thank you so much, everyone. And we will talk today about the triangular method. First of all, we'll talk about the correct diagnosis of epilepsy. The journey of epilepsy treatment starts with the correct diagnosis. What does that mean? It means that we have to make the right diagnosis. This is the cornerstone. This is the foundations of the treatment of epilepsy. So when we make the right diagnosis, all the steps on top of it will be having a strong foundation. So the correct diagnosis starts with evaluation by the neurologist. So you'll see the neurologist and then do a full evaluation, do a history evaluation, which means that you talk to the patient and then see the details of the events, how the seizure starts, what the patient felt at the beginning, and so on. And the most important thing is that how the progression of the seizures, how the seizure started from one area to another, and how the progression happens. The best thing you can do is to record the video of the seizures. That will show so much. You know, you can say that a picture is more than 1,000 words, but a video is more than 10,000 words. So it's more valuable. So if you do have somebody with seizures, you can take a video. And then after doing the history and the description, then we go to the physical exam. So we do perform physical exam on the patient. And then after that, we do testing. So there are multiple tests we can do for epilepsy. The first test we can do is the brain MRI. So brain MRI is a picture of the head. So we know the structure of the head, if there is any abnormal cells did not form right, there's any scar, any abnormal blood vessels, abnormal veins, arteries, all of these things can lead us to what is the diagnosis of epilepsy, like what is the cause, how it happened, there's any inflammation, tumors, or anything that can cause seizures. And then the second test we can do is an EEG. So EEG is called electroencephalogram, is a test that we can do to diagnose the seizures. And then at that time, we can do like the detection of the brain activity. And then we can say if the patient has focal epilepsy, when seizures are happening from one side of the brain or one spot, or generalized epilepsy, when activity happens all over the brain. So these are all important differentiations. And then after that, there are a few more testing. We can do blood testing for like CBC and liver function, kidney function, electrolytes, glucose. All these things can help to get mostly a baseline. And then after that, we can do something for evaluation. With seizures, we can do an evaluation with a genetic test only in specific cases like pediatric cases. So all these are testing that we can do to help to make the diagnosis of epilepsy. And we should differentiate the type of epilepsy. We have focal epilepsy when seizures happen from one spot. that will be happening from the EEG itself and from the if there is any spot in the brain MRI. Or generalized epilepsy seizures happen all over the brain, and that's a unique type because the treatment is different from focal epilepsy to generalized epilepsy. And then after that, we choose the correct treatment. So the correct treatment is very, very important. When we have epilepsy, we should choose the right medicine. First of all, based on the epilepsy syndrome, if we have a focal epilepsy or generalized epilepsy, to know that all medications work for focal epilepsy. However, if somebody has generalized epilepsy, some medications that work for focal epilepsy can make generalized epilepsy even worse and can worsen the seizure. So that's a very kind of like alarming thing, that people with focal epilepsy, they can have worsening of their seizures just because of the medicine. So if you have generalized epilepsy and then you give them the wrong medicine, so knowing the type of epilepsy is super important, because that is how you can differentiate and then give them the correct treatment. So what is the best medicine for epilepsy? The best medicine depends so much on the patient's background, on their clinical background, what they have. If they have any anxiety, depression in the background, then you avoid certain medications or give them certain medication. If it's a woman of childbearing age, you give them a medicine that is safe in pregnancy, and so on. There are so many different factors that you do to help to get the right medicine. So in my clinic, no two patients will get the same treatment because everyone is unique, and I consider their background before giving their medicine. And then after that, the correct dose. When we give a medicine, we like to always give a correct dosing, which means that we have to give enough amount of the medication to be able to have seizure freedom, which means that you give enough amount of medication so that we can have the medicine to be enough in the body, cover the seizures. So what happens, I see in many patients, I see in my clinic or when I do consultations internationally, I see many patients who are on low doses of medications. For example, medicine like levetiracetam or Keppra, we start with 500 milligram twice a day and then go up to 750 and then even 1,000 twice a day. And some people will just give 250. That's like not enough. So it's kind of somebody takes Tylenol or paracetamol for their headache, and they, instead of taking 500 or 1,000, take like 100. So that's not enough. And that's why seizures will continue to take. So the right dose is very important. And then the duration of seizure treatment is very, very, very important. We aim to have a long-term treatment. So long-term treatment means that we take the medicine for a long time. Usually the treatment, if it starts in later in life, like after age 12, not in little children, then usually it is something that's going to stay for longer. And we think of epilepsy as a chronic condition that needs very long time of treatment or lifelong. So overall, what is the best medicine? The best medicine will be chosen based on the patient's background, the type of epilepsy, pregnancy potential, other comorbidities, or other conditions the patient has. All of them, they are put into consideration when we do it for that. So these are just an introduction. So I would like to dive deep right away into your questions. So that's why I did the live today, to answer all of your questions. So let's go directly to your questions, and then so ask any questions you want, and I will answer them all. So here's just a few rules about questions. So if you have a question about epilepsy, write it down. Put a question mark before that so that I know this is a question, not people talking to each other and replying to each other. So just put a question mark. I will, and before that, 1 or 2 question marks before the question, and then just ask something simple or short. Avoid the long messages, because that makes it easier for me to read it and go through multiple comments. And use the generic names of medication, which means that instead of saying Keppra, just say levetiracetam, which is like the brand name, because the local brand names can be different from one country to another. And don't repeat your questions. I will get to all the questions from the beginning all the way down. So don't repeat your questions, because that will make it harder for me to get to them. Okay, so now let's go to your comments. And from India, and then we'll come to India. I wish, hopefully that I will visit, but I don't have any visits scheduled right now. But if I visit any country, I always will announce that. So now in my locality 4 months ago, we found epileptologist and said that also my mother, if next record a video. Yeah. Yes, definitely record videos if seizures happen. That helps a lot for discussion and for the evaluation. Okay, so avoid many messages, because that will makes it harder for me to go through them. But if Kebra monotherapy is enough for GME, could Act be the same effective if switch done correctly? Why don't we have the FDA approved like Kebra? So the question is that if Kebra was working, can we switch to Act in GME, juvenile myoclonic epilepsy? The answer is yes. So Act works for juvenile myoclonic epilepsy. The FDA approval is only just something like legal and kind of just a regulation type. Some studies were done on focal epilepsy, some studies were done on generalized epilepsy, but we know that Act work for generalized epilepsy, so definitely it can be given. And the switch from Kebra to Act is overnight switch, and 1 to 10 ratio, which means that if somebody was taking 1,000 of Kebra twice a day, will be 1 to 10, so will be 100 of Act, an overnight switch. Like you just get the Act and start taking it and stop the Kebra completely. This is the only medicine that can we do overnight switch without any titration. Okay, so my husband has seizures due to right temporal lobe cavernous malformation. What is the chance of being seizure-free after brain surgery to remove the affected area? Excellent. So the question is that if somebody has temporal lobe epilepsy and have cavernous hemangioma, what are the chances of seizure freedom? The chances of seizure freedom if we have lesional temporal lobe epilepsy. This is called lesional, meaning there is a spot in the brain that causes a seizure, and here is cavernous hemangioma. And then it's only one side. If we prove that by doing EEG and long-term EEG monitoring and everything, then the chances of success in that type can be vary between 60 to 80%. So that's really good chances. This is the best scenario and least amount of side effects when of the surgery when the lesion happens on the right side. So when they have the right-sided epilepsy, it's much easier, much more successful. So that can be done with very good success. And especially in the temporal epilepsy. Very important question, is epilepsy curable or not? At this point, epilepsy is considered a chronic condition that can be treated definitely, but is not curable. We cannot cure epilepsy. So we cannot cure epilepsy, but we can definitely treat it and help with that. It's kind of like hypertension, diabetes. You can get medications to control it, but there is no cure so far for epilepsy. So Ella said that I have a bad breakthrough seizures monthly. They have put me on Brivaracetam 100 twice a day. Thank you for using that term to 125 a day. Will you consider enough, or would you have to put them up more? So I cannot give medical advice to one patient, but however, the strategy for epilepsy treatment is we give the first medicine that we think this is the best medicine for this type of epilepsy and so on. And if the seizures continue despite being on that medicine, then we increase the dose all the way up to the maximum. So the maximum of Act is on paper 100, but however we went to 150 twice a day with no issues. So even some patients we had higher doses than that. So definitely can be given at higher doses. And if seizures continue despite being on that medicine, then we add a second agent that can work synergistically, means like they work together with the Act. And if both does not work, then we go to the drug-resistant epilepsy. Yesterday's talk was about drug-resistant epilepsy. The video is saved, so you can go back and watch it and learn more on how we deal with drug-resistant epilepsy. Okay, so Lisa asked if I wasn't an epileptic patient, but due to some complications, I became one, and I have been on Tegretol and now carbamazepine, but I keep having seizures. Yes. So if somebody continues to have seizures despite being on medications, we have to push the medicine higher, increase the dose, and then if that does not work, then we can switch to another medication to help control the seizures. So that's the strategy for all treatment of seizures. Okay, thank you. So always put a question mark before your question. So now I know that it's a question, not a statement or talking to other people in the chat. Can my generalized seizures cause dementia, early onset dementia? The answer is no. Dementia by definition is like loss of brain functions, not just memory. So memory, one of them, and other functions. So there is no link between epilepsy causing dementia. We know that dementia by itself, Alzheimer's, can increase the risk of seizures, but that's not the cause. The second thing is that there is memory loss with epilepsy, and there are multiple causes. There is a whole video about memory loss and epilepsy. You can watch it on the YouTube channel. However, the answer is that there are multiple causes of memory loss in epilepsy. We can have memory loss due to recurrent seizures, so that can cause memory loss. Other thing can be due to having side effect of medications, especially the carbamazepine, Tegretol, these medications, and Depakote, valproic acid, and topiramate Topmax. These are all can be causing memory loss. And then the second thing is that when we have memory loss, can be due to depression and anxiety, lack of focus, all of that. So you choose, like you figure out which one is the right cause and correct it. But definitely epilepsy does not cause dementia. All right, thank you so much for the super chat. And should fractured shoulder fracture due to seizure attack? I was consuming alcohol and lack of sleep. I dazed with 200 milligram levetiracetam and was getting jerks and lack of sleep and frustrated clobazam. I stay dizzy all day. Can I go to gym and fix myself? Okay, so important consideration here. First of all, we know that people with epilepsy are more sensitive to alcohol. Alcohol can trigger seizures in people with epilepsy. So that's important to try to avoid drinking alcohol because it can cause seizures to happen. So that's number one. Number two is that when people have issues with medications. So, for example, levetiracetam, Kipra causes psychiatric side effects and can exacerbate alcohol use. So it's better to avoid that. And then the third one is, can we go to the gym and play at the gym and do weightlifting? The answer is yes, under supervision. For example, try to avoid deadlifting and things that if you have a seizure and things will fall on you, that will be a problem. So yeah, so thanks so much for the super chat. Yeah, 2000 milligrams. That was just a typo. I figured it out. So yes, you can go to the gym, but it's very, very important to be under supervision, especially when the seizures are not under good control. Okay. Okay, let's go back to more questions. Just put in the question mark. Is this live only for epileptic patients or PNS as well? Yes, PNS, of course, it can help. So PNS is called psychogenic non-epileptic seizures. It's part of seizures, so definitely I'll be able to help, and that's the things that I worry a lot about. So non-epileptic seizures, psychogenic non-epileptic seizure is an important part of seizures disorders. It causes seizures that are the same. They can fall and shake and have disability but the reason why they happen is different than epilepsy. That's why we differentiate it from non-epileptic seizures. I have a whole video series in the playlist on YouTube. You can go watch it. It's called Psychogenic Non-Epileptic Seizures. I go about the diagnosis, what it is, how it happens, what are the causes, and then the most important one is about the treatment that you can watch. Is epilepsy curable? Not. Yeah, we answered that question. When patients are not responding to drug, what we do? Yes, this was the whole video. Yeah, we did yesterday. I recommend you go back to that video from yesterday. It's available on YouTube. That patient have not responded to medication, then we have to do surgical treatment for them. Excellent. So the patient has been diagnosed with temporal lobe epilepsy with mesial temporal sclerosis and in 2 medications. What supplements will you recommend for this, please? So supplements for epilepsy, there is a whole video about that called Supplements for Epilepsy. Overall, the recommendation is that we avoid natural supplements and other supplements in epilepsy because there are multiple other concerns. One of them, sometimes that there is packaging issues, sometimes there is contamination, sometimes there is an interaction with anti-seizure medications like ginkgo biloba. It's very bad for seizures, can cause seizures to happen. So you should avoid that. So we don't recommend any supplements. However, there are only just 2 supplements that we recommend for people with epilepsy. First, if you have any deficiency in vitamins, supplementing that helps. So somebody has vitamin D deficiency or some B12, supplement that works. And then if you have women of childbearing age, we give them folic acid, and then we give people who are on especially older anti-seizure medications, we give them vitamin D and calcium to avoid bone issues. Okay, salam alaikum, alaikum salam. I suspect that I have epilepsy. I'm a student right now without medical access. Right now, they're only focal. I suspect a temporal lobe. Can I ignore that until I graduate? So the the answer is we know that epilepsy can get worse with time. So if you have seizures and they are epileptic seizures, I'm not sure like how did you make the conclusion that they are temporal lobe epilepsy, but if you do have seizures and they are not controlled, not being treated, seizures tend to get worse with time, and then now they are focal seizures, and then they will dig a path in the brain and become generalized seizures. So it is not recommended to wait, and if you have seizures, right away go to treatment. I have Kipra and heard can cause mental health issues. Yes, Kipra can cause lots of mental issues, depression, anxiety, anger, mood changes. So be careful with that. From New Mexico, welcome. Okay, so my doctor reduced the dose of Gardinal 60 to 30 because I have one seizure free. What should I do? Add my life routine so I am safe. Gardinal with 30. Okay, so there are multiple things here. So why did they decide to stop the medicine? We know that epilepsy is a chronic condition, so we avoid to stop the medication even if the seizure stops, because that can cause seizures to come back, and we don't recommend that. But however, if the doctor decided to stop the seizures, then that's fine. So it's like we avoid stopping the anti-seizure medications. It's case by case basis. But if somebody started to drop the medicine and the intention to completely stop it, just kind of be careful if seizures come back. Avoid driving and having anything that can affect the seizures. Okay. And the question is that what should I approach in handling someone who is experiencing post-ictal psychosis? So post-ictal psychosis is a state that happens after a seizure. People will be having issues with psychosis. It means like they will be confused, have hallucinations, delusions, aggressive behavior. All of that can happen after seizures, especially temporal lobe epilepsy. How we can do that? We can handle them. Usually it lasts for like 2-3 days and sometime longer, but much less. And what we do, we can put them in a quiet, calm environment. Sometimes we have admit them to the inpatient psychiatry, and sometimes we give them antipsychotic medications that can calm down the brain until things go back to normal. Okay. More question. My son is having seizures at 6 years due to chronic health issues, and his seizures are not regular, sometimes only when he misses medication. Will ever be seizure free? Yes. So I cannot answer for one patient. However, if somebody takes medications and then seizures only happen when they miss medicine, hopefully like they should not miss any seizure medication. And the rule is that every time you have a blood level of seizure medicine, every time you miss a medicine, it will dip down. So we should avoid any dips in the seizure medications. If we miss a seizure medicine, we have to make it up. That is the rule, so that we have steady state of in the blood of anti-seizure medications. So the recommendation is that if you take it morning and night, let's say you miss the morning dose, take it as long as you remember, like right when you remember, do throughout the day. And if it is nighttime, you take it night and morning at the same time to make up the missed dose. Okay. I'm having epilepsy patient after taking lobozam, maybe it's clobazam, 15 milligrams. My hair and face color started to change by day. How do I solve it? So I'm not sure, like it's depending on the one patient alone. So you just talk to your doctor. Maybe they need to change the medicine. Maybe try to avoid sun. Maybe there is another cause that causes this skin change. So it's all individualized. Okay, so my son is 11 and have seizures, and then they want to consult with me. So yeah, so we can do consultations. So I have a link under the video here. You can do a consultation with me. I do have international consultations everywhere outside the United States. However, I only see adults 16 years and older, so I don't see any kids and pediatric, because that's a different situation. It's pediatric epilepsy, and that's only for kids. And there's a doctor specialized in that. It's called pediatric neurologist. So I cannot see kids younger than that. Thank you so much. Yeah, paramedic diagnosed with PNES. Yes, it can be very disabling. Do you think lacosamide is safe for bradycardia? We know that lacosamide can cause slowness in the conduction of the heart, which is called PR interval. It can make it longer, and that makes slowness in the conduction. So if there is a problem in the PR interval, then lacosamide might cause an issue. Sometimes there are other causes of bradycardia, especially in healthy adults. So talk to your doctor about that. So, are there any new clinical trials working on patients with drug-resistant epilepsy? The answer is yes, and I'm involved in multiple of these clinical trials. So, there are new trials for medications, and the example is the azitocannar. It's a new medication on potassium channels. There is a whole video about a new treatment for epilepsy you can watch. And then there is stem cell therapy that is now being done. Stem cells that we are implanted in the brain, and they can secrete GABA and help with the excitation in the brain and help to fight the seizures. And then the other one is gene therapy for epilepsy. So especially the epilepsies that have genetic disorders like Dravet syndrome, there are now gene therapies that can help. Okay, so we answered that question, and if I skipped your question, please ask it again, and I will get to it. Okay, so I'm epileptic patients and take medications for 7 months. I'm seizure free. Congratulations, that's good. What you need to do is that you need to continue taking the medications, because if you stop the anti-seizure medication, celebrate too early, then seizures will come back. So be careful and don't stop anti-seizure medication. So what about stomach auras? So stomach auras are part of temporal lobe epilepsy. There's a sensation in the stomach. I have like an interesting case that somebody has these stomach feelings and went to the doctor, and then the doctor did not know what they are, so they sent him to the surgeon, and then the surgeon said like, oh, you have stomach issues, let's do something. And then they ended up doing a surgery for them. They did appendectomy, like they took the appendix and the gallbladder, and then of course they did not stop, and then it turns out that they are seizures. Okay, excuse me. Okay, so if you have any, my son has generalized seizures and is doing RNS surgery in Florida next month. They're targeting the thalamus to stop the seizures. Do you think that will help him? Okay, so there are new studies about the thalamus and the RNS system for generalized epilepsy. If you are talking about generalized epilepsy, juvenile myoclonic epilepsy, generalized epilepsy, not focal epilepsy with generalized seizures, just generalized epilepsy itself, there are new studies about that. The initial study in the Nutalis, called Nutalis trial, they just released the first 1 year of that, and it was not successful to make a meaningful difference. So I'll be worried about that RNS for generalized epilepsy. That is my own opinion. Some doctors might disagree. It's like, oh yeah, it works for generalized epilepsy. RNS is designed to be focal and stop the seizure at onset. So I have a hard time, figuring out how it can help somebody with generalized epilepsy, because it's like already started all over the brain. But anyway, so there is some debate about that. We need data. The data so far shows that it's not very effective. Okay, so my wife is 5 months pregnant and is on Livipil and clobazam, folic acid, 5 milligrams. That's a high dose. In the 4th month, double marker test shows no defect. Will continue these medications. Okay, I cannot answer about a specific patient, but in general, people with epilepsy, they can get pregnant, and then when they get pregnant, we have to make some changes for them. For any women of childbearing age, we give them folic acid to prevent any malformations of development when it happens. So always give them folic acid. And the second thing is we try to, so the dose of folic acid is controversial. We give 1 milligram only, and then some people give 4 milligrams. That's too much. But anyway, so that's kind of individualized. We give only high doses when we have previous issues before, but otherwise no. But anyway, so we know that medications changes their levels throughout pregnancy, so we have to always keep increasing the doses. And then we know that levetiracetam, Levipil, is generally safer in pregnancy. Clobazam is not as safe as Levipil, so that it can have issues. So it's all individualized and with the discussion of the doctor. But we always have to continue the medications. Hello, I suffer with SUDEP. I also have a VNS device. So SUDEP is sudden unexpected death in epilepsy patient. So no one can suffer SUDEP, and because it's by definition it's death. So yes, some people can die from their seizures if it was strong, but devices like VNS can help to prevent this. Okay, since okay, so yeah, put a question mark so that I know that's a question. And okay, so what can replace Keppra when taken with Xcopri as a very strong side effects on paroxetine, propranolol, amlodipine too? Thank you. Okay, so I cannot answer like specific people's questions because that's a medical advice, and I need to understand the case completely to be able to judge a specific case. However, we know that Xcopri can interact with other medications, can make other medications higher levels. So what we do is that we lower the other medications to make a room for the Xcopri to work. So the way I think of it is that Xcopri, cenobamate, when it comes in, you have like a cup full of water with the other medications. Then if you add Xcopri, it will overflow and then have lots of side effects. So what we need to do, we need to dump some of the water in that cup to give enough time for the medicine to work. So what we do is that we lower other medications to deal with the side effects. I never had a seizure until the August at 2023 at age of 64. I never tell me what causes the seizures. MRI normal, EEG, CT positive, and EEG positive EEG. Why they can't tell me the cause? Yes. So we have two peaks of epilepsy in life. The first peak means lots of people have epilepsy is at the first 6 years of life. Mostly the causes are genetic, infection, birth asphyxia, means like related to birth or genes. And then there is a steady state of epilepsy. And then there is a huge peak after age 65. And the reason why in these patients are mostly structural means like something in the building of the brain. The first is stroke, and then after that, traumatic brain injury, and then brain tumors. So these are the most common causes. And sometimes we do MRI and then we don't see anything, and we call it idiopathic. But that doesn't mean that there is no cause. It means like it's too small to be detected by the testing. But yes, you can have epilepsy with normal testing. Okay, patient said that my husband have epilepsy and was a year ago before age 35. Keppra 100 twice a day and have this dose. Does it have side effects? So overall, Keppra has less side effects than other medications. Usually it's safe and good on the body. However, it does have psychiatric side effects. It causes depression, anxiety, mood changes, anger, all of that. So maybe you just check with these side effects. Important question from Samir. Do seizure frequency increase over time? The answer is yes, if it is not treated. So if epilepsy is not treated or inadequately treated, then seizures tend to get worse with time and tend to have more seizures over time. So this is the nature of epilepsy. It kind of digs a path in the brain with time, and then it will keep happening, and then it can cause seizures to get worse. Okay, so it does help a lot. I have VNS device and it's over 5 years ago. That's good. So we know that VNS device is a good device that can help with seizures, and the benefit accumulates over time, which means that every year we have more and more benefits. Okay, so try to put a question mark before your questions, and then if you have like a smaller questions, that will be helpful. Okay, so my son was diagnosed with, that's a lot of questions. My son is diagnosed with epilepsy, 6 years, medicine symptoms stopped a year after, as far as I'm aware. I'm excellent. He is excelled in life, academics, and age 29, showing signs of partial aware seizures, looking for like a psychosis to the average person, becomes a vegetarian, and then at that time needed to expert diagnosis in Oklahoma. Some help me with information, has lost life, his wife and children due to this. Thank you, God bless. All right, Tammy. What I would say is that in any patient who have seizures, they can get dormant for some time and then they activate after. And what you need to do is that you need to see an epilepsy specialized neurologist, we call epileptologist. So in Oklahoma, in Oklahoma City, I know that there are epilepsy centers. So you can go there to epilepsy center, do a full evaluation, and maybe it's just seizures that need to be treated, and sometimes other causes, so need to an evaluation. Okay, so which surgery is best for generalized epilepsy? So generalized seizures is different than generalized epilepsy. For example, focal generalized seizures means shaking all over, can be a focal epilepsy, which means the seizure starts in one spot and then spreads and then becomes generalized, or it can be generalized epilepsy. It's called primary generalized seizures, means that shaking all over from the beginning with generalized epilepsy. So we have to differentiate which one is that first, and then after that will be, if it is focal epilepsy, then the treatment of focal epilepsy. If it's generalized epilepsy, we cannot take out any brain area because it is something that is all over the brain. So what we can do, we can give stimulation devices like vagus nerve stimulation or deep brain stimulation. There are studies now being done for responsive neurostimulation, but the results are not very promising so far. Okay, so my doctor tried to tapering, as he said it did not work. I feel lightly like that during bathing. I've been consulted and other doctors increase the medications. Is that right? So I cannot say about a specific patient. So it's all discussion with you and your doctor who knows your case best. If you want, I can do a consultation and then they can understand your case completely and then give you the medical opinion. But it's hard to judge with patient. What are some side effects of Keppra? As I said, Keppra is generally a safer medicine on the body. However, initially it can cause dizziness, sleepiness, tiredness, especially in elderly more than age 65. They have lots of sedation and sleepiness from Keppra. However, it is overall a safer medicine and it works well. And then the most side effect that we worry is the psychiatric side effects. Okay, my husband was previously seizure free for 13 years. Being on Keppra, seizures were caused by CCM. I don't know what that means. Sometimes abbreviations can be very. We just put on Vimpat after having 2 seizures in the last year. What is the success of that medication? So overall, let's tell you about the statistics of medications for seizures. The first medicine is the best medicine for seizures. The chances of seizure stopping on the first medication is about 50 to 70%. If the seizures are resistant and they do not respond to the first medicine, then the second medication we add is much, much less successful. It's not about the medicine, it's about the type of epilepsy itself. It will become more resistant to treatment. And then the chances of the seizure stopping after the second medication drop dramatically to only 15%. And then if 2 medications fail to control the seizures, it is an epilepsy that is resistant. And then the third medication is less and less successful and gone only to about 1 to 5%. I'm a 36, Yusuf, old, and had seizures in 2022, and I'm taking Keppra 1500 twice a day and Vimpat 300. And will that considered a high dose? Well, they are the maximum doses of these medications, about maximum 1500 of Keppra and Vimpat. 300. So these are definitely high doses. The high dose is different from one person to another. Some people will tolerate the medications very well and be on high dose and have no side effects, and some people will have side effects. So what differentiates is that if you have side effects or not. So if you're doing fine, you take the medicine, no side effects, then that's good. That's just continue. And then if you're having side effects to the medications, then like dizziness, sleepiness, tiredness, psychiatric side effects, then maybe it's time to switch the medicine or lower it. Sorry, I am late for an hour, not missed. And he's levetiracetam since started having seizures, and he's still on. And now an MRI with basal ganglia shrinking, and he's struggling. Okay, so that's why I need to have. If you put a question mark, if you have a question, and why is SUDEP more common in adults than children? The answer is that is correct. SUDEP is called sudden unexpected death in epilepsy patients. This is overall a rare incident. So it happens about 1 in 1,000 in the community, like a general population of epilepsy. It happens 9 in 1,000 in people who have resistant epilepsy. So overall, it's a rare condition. In children, it is more rare to happen because it happens about 1 in 4,000. So it is very rare to happen in adults and in children, but it does happen. And the risk factors for SUDEP is generalized seizures when they have a lot of generalized seizures, shaking all over, nocturnal seizures, seizures during sleep. Male is more than female, young age 20s or so. And then if somebody has mental, like intellectual disability, it can cause developmental delay. It can increase the risk of seizures. Okay, so Matthew has a question. Why all my doctors act like the seizures are not a big deal? I feel like I don't really cure. I haven't had much testing done and just put in 3 different pills now just in Keppra. Okay, so that is the difference between a doctor who's really specialized in seizures and epilepsy than other doctors. So that's like a huge difference in the care that you will receive. So for best care, if you have epilepsy, you need to be taken care of by a neurologist specialized in epilepsy. They are called epileptologists, and they live in epilepsy centers. So like my center is an epilepsy center, and I see patients only with epilepsy, so that's kind of provide an excellent care. So if you have like a doctor who's not really like well versed in seizures, it's time maybe to see an epilepsy center to get a better treatment. Okay, so I'm 21, Ahmed said, and generalized epilepsy is in Keppra. My seizures go away eventually, and I have to stop taking the medication? The question is like, can we stop the anti-seizure medications and will they go away? Well, it depends all on the cause, type of epilepsy, response to treatment, and so many other factors. So overall, yes, there is a chance that seizures can be well controlled, especially with the first medicine. But if seizures continue, then at that time, like we need to figure out other treatments. But if can you be cured? It can be controlled, but stopping the seizure medication is a big decision, and we try to avoid stopping seizure medications because seizures will be very high risk of coming back. Do you advise to change the Keppra if it is causing mental illness? Yes. If somebody is having mental issues, means like depression, anxiety, anger, mood changes, then switching the Keppra definitely can help with that. Medications that are positive on the mood are Lamictal, lamotrigine, Depakote, valproic acid, Tegretol, carbamazepine. So discuss with your doctor what is the best way to treat that. Okay, so if you have question, explain. Post-ictal mania, please, the difference. Okay, so post-ictal mania, so yeah, there are sometimes post-ictal changes that can happen mentally. So it can be mania, it can be psychosis and all of that. So patients will have lots of energy and other things. So this is because the seizure can change the chemistry of the brain and the equilibrium, and until it comes back to equilibrium, then these symptoms happen. Okay, so the question is how long can you stay on medications, Dilantin and Triliptal, and then Briviac Triliptal was taking Dilantin for 8 years now. Long take these medications. I'm 45 years old. So, we can continue taking the medications for a long time. That's why we try to get a medicine that is safe and on the body to be able to take it for longer time. So what we recommend is that for patients who have been on medication for a long time, we always screen for osteoporosis because that can happen with long-term treatment, especially the older medication like Dilantin and Triliptal. And then the other thing is that we do screening osteoporosis, and then we give them calcium and vitamin D to avoid the osteoporosis. Important. Is it necessary to increase medicine level in pregnancy? Because my wife is 5 months pregnancy and then hemoglobin is 1. So we know that over pregnancy, the levels of medications will drop down. So we always make sure to compensate so that we have enough medicine in the blood. Is it so from TikTok? Is it worth getting RNS device implanted if I am using just getting auras? So the question is that if you're only getting auras, is it worth getting RNS? Well, the definition of seizures success, if you have no generalized seizures, that is considered success. But if you have auras, it's not considered like a big deal. However, if the auras are frequent and they are repetitive, they affect the patient's performance. For example, somebody has lots of deja vu and memory auras, and they can affect the performance. Maybe it is worth giving the treatment. So it's all individualized and decision. Okay, so can lamotrigine replace Keppra taken with excorporeal focal epilepsy? It can be. So lamotrigine is positive in the mood. So discuss with your doctor if it is worth switching. Okay, so the question is that I'm having seizures once every 6 to 8 weeks, and my epilepsy is temporal on the left side. So if somebody is having seizures that are continuous, 6 to 8 weeks is a lot of seizures that are happening. Then this is called drug-resistant epilepsy. You're on 2 medications and seizures continue. So that is the time to explore other ideas and other treatments, that like surgical treatment. So you're welcome. If you want to book a consultation, we can discuss more what is the specific treatment for you. But overall, I had a video yesterday about drug-resistant epilepsy that goes over the surgery and other treatments that are available. You can watch it. Okay, I've been carbamazepine for generalized epilepsy for 15 years. I was well controlled. Now benefit better if I switch to lamotrigine. That is an individualized decision. If you switch from one medicine to another, we try to switch to medication that has similar effects and similar mechanism of action to avoid issues from the switch itself. Because how we can draw phenytoin and replace with other anti-epileptic drugs. So if somebody has taken phenytoin, as I said, you will switch to a medicine that has similar mechanism of action. So phenytoin works on sodium channel. So you want to do a medicine that works on sodium channel. So newer sodium channel blockers are Vimpat, lacosamide, and the medicine Lamictal, lamotrigine. My child has cerebral palsy, kids, and then seizures not coming controlled on vigabatrin, steroids, topiramate, and now CBD oil. EEG is bad, is not able to walk independently. Yeah, so unfortunately, sometimes the kids, especially, they have very difficult controlled seizures, and then they're activated. So. Okay, so more questions. Abdullah says, "Salam, doctor. I have been a couple of months ago and scheduled for MRI ends of this month. That's good. Recently did the PET scan. My issue is that I keep taking my medicine, Vimpat, Excobra, but not working. Yes, so that's what we're trying to do. Trying to get all the testing done for potential surgical treatment that hopefully can be the cure for seizures." What information can neuropsych evaluation tell us about seizures? So neuropsychology evaluation is a detailed test for memory, for memory, and then that is a test that memory, language, and then so on. So that is an important test that can tell us, first of all, what is the memory function and language function, if there is any area that does not work well. So it helps us to kind of just a surrogate marker for where seizures are coming from. And most importantly, we try to diagnose where the seizures are coming from and get a baseline. If we do any surgery, what is the risk of any memory loss? Why my comment was deleted? Ali, I did not delete any comments, so please put in your question and we'll answer it right when I see it. Okay, so the question, can stem cell be effective in Lennox-Gastaut syndrome, CHD gene mutations? At this point, stem cells are only being studied on focal epilepsy, where you have like a seizure focus and put in there And then so far it's not available for Lennox-Gastaut syndrome. Maybe it's in the future. Question there on TikTok: Can MRIs make seizures worse? The answer is no. It does not make seizures worse. I have to take Keppra 1500 twice a day and the Lantin 100, and then suffer focal aware seizures under control of humans. Can I? I could not talk during a seizure, confused afterwards. Yes, this is what happens when you have a focal unaware seizures. Then somebody will be confused. Yes, would like to book a consultation. Yes, you're welcome. You can just go to the link under this video description, and then book your consultation whenever time that works for you, and then we'll see you. So my son is 11 years old. Can I book a consultation? Unfortunately, I only see adults 16 years and older. Kids are seen by a pediatric neurologist. I'm an adult neurologist. What is the latest update on prophylaxis of anti-seizure drugs in intracranial hemorrhage? So when intracranial hemorrhage happens, we can give anti-seizure medication to avoid the acute seizures. However, after that, if no seizures happen, no need to continue the anti-seizure medications because it does not prevent epilepsy from happening in the future. How I know if a seizure is coming on? Well, it depends on where the seizure starts from and what type of seizures you have. Some people have like a aura or a warning, and some people do not. Does sleep affect epilepsy? The answer is yes. Sleep is very, very important in epilepsy. If you have lack of sleep, abnormal sleep, irregular sleep, all of that can cause seizures to get worse. So definitely have a good regular sleep cycle to help. What effects of memory loss in epilepsy? Yes, we have answered these questions. You can go back to the beginning of the live, and then I did answer. Can autism increase the risk of having seizures? Yes. I have a whole video about autism and epilepsy. Yeah, the answer is yes. Autism can increase the risk of seizures. Kibra rage is real. Yes, it is real. Kibra rage. Okay, what? Okay, so I'm almost at the end. Okay, as visual and auditory symptoms considered focal epilepsy, my son is poorly diagnosed, and I will book a consultation with you. Yes, so you can, you can book a consultation and we can discuss. These are specific for every patient, so it's hard to make a generalization. I'm Divan from India. I'm taking Brivac, lacosamide, and ENT. Doctor said that the side effects of medicine. Some ringing there. Yeah, sometimes medication can cause ringing in the ear. So how to avoid tongue bite and seizures? Unfortunately, there is no way we can avoid the tongue bite during the seizure itself, and the recommendation is not to put anything in the mouth of the patient during the seizure because that will exacerbate the problem. They can bite through the metal or anything, so don't put anything in their mouth. However, treatment of seizures can prevent the seizures from happening and prevent the tongue bite, but you cannot do anything to prevent the tongue bite during the seizure. Okay, so last one. I have been diagnosed with focal epilepsy. I'm currently taking Keppra 1500 twice a day. Could you please advise maximum recommended dose of Keppra? I'm 35. So the maximum recommended dose of Keppra is 1500 twice a day. Higher doses than that will not really cause any significant improvement in seizures, but it will cause more side effects. Okay. What should I do for the ringing of the ear? Well, it depends on the cause. It can be tinnitus, which is ENT doctor. It can be a side effect of medication. Then you might consider lowering the medicine or change it. Depends on the cause and discussion with the doctor. So we got to the last question. So thank you all for your participation today. Last one. Okay. The Lantin effects in my liver. What are the highest, safest levels of liver functions? So when we have dilantin effect on the liver, we usually have like a little bit of like higher levels. So instead of like one time will be 2 times or 3 times the level. So for example, if the cutoff is 50, usually 100 to 150 is an alarming one. So definitely you have to make sure that you monitor the blood levels and not have it more. So thank you so much for this, and definitely I'll be doing more live streams like this, so definitely I'll be happy to help. And this video is about the surgery for epilepsy that you can view in details, understand what is drug-resistant epilepsy, what surgery can be done, and see you on the next time. Salam.